health and a little wealth and a lot of love.
Is there an alternative option?
Yeah, so I'm a huge proponent of the GLP-1s, and I know we talked about Ozempic face and butt,
which is trending on YouTube.
the last episodes, and the Wegovy and Zep Bound and all these new medications that are coming out. But honestly, the terzepatide, which is the Menjaro and Zep Bound, and it's a double hormone mimic, so it mimics it's a GLP-1 analog and a GIP analog. So we're starting to see numbers that correlate with bariatric surgery. So people can expect to lose around 20% or 20+% of their initial body weight by this just being on this medication. I think implementing lifestyle as well. But if you think about the numbers that you typically see in bariatric surgery, and it depends on your starting weight, and there are a lot of other factors that come into it, but to have a medication where you don't have to deal with the potential
that's the thing, though.
Surgical or post-op complications, if everyone had access to it, I think it's definitely a good alternative, and at least
your
something.
Your body naturally produces GL1, which we learned that in the last episode, right?
Yeah, these medications just basically have a very exaggerated effect of that hormone. So it exaggerates. It's not something that you would get just naturally from your GLP-1 hormone, but it definitely can give people some really good numbers, some really good weight loss numbers. And sometimes too, the other thing that we see, and we watch these shows where people, they aren't even candidates for bariatric surgery yet because they need to lose weight to even be able to be operated on. And so I think these medications also can be a bridge and can help people. So
let me get this straight. So you're saying that these GL1Ps are just as effective as gastric bypass?
I'm saying the numbers that we're seeing can definitely be similar.
That's such a doctor, right? I'm just kidding. No. But no, honestly, there's a beauty in that. So you're not going to say yes, but you're going to say that the numbers are looking really good.
Yes, and if you start off at a higher weight, you probably are going to lose more weight by doing bariatric surgery.
If you have a higher weight, don't you have more comorbidities? What's that word again?
Yes, you do, but that being said, you probably, if you need to...
Because you should be underneath... I'm sorry to interrupt you, but you should be underneath anesthesia if you're, I know really overweight people should not be on anesthesia or should not, right?
Yeah, so that's why they have safety parameters and protocols where they won't operate on... Many surgeons won't operate on people until they're able to... until they're able to show, too, that they're able to follow guidelines and they're able to start kind of changing their lifestyle. And so that's part of why they have surgical parameters too. But I think these medications can be helpful pre-op. I think
less invasive.
If you have somebody who's really motivated and wants to change their lifestyle and they want to use this medication, they can get, there are plenty of people who have lost 80, 100 pounds.
Wow.
By
these medications.
By these medications and lifestyle and implementing some lifestyle changes.
Yeah.
But
if you want to learn more about that, then just go and watch the other episode, or you can go to SusanScruggsPodcast.com. Emily has a 7-day meal plan that resets your cravings. We're kind of crunchy over here a little bit. We're moving. We did sunbathe today. Did we do it once? Did we ground today?
I don't know. You grounded today. I did ground today.
You did not ground. We have a geriatric cat named Ollie, and so she's dementia.
Outside.
Yeah, so we take her outside for her senior living outside time.
Or sun time.
Yeah, sun time.
With a little health and a little wealth and a lot of love, that's the life that we live. Susan Scruggs.